We are all going to die at some time. The question is, do we have the right to make that decision for ourselves on how and when we die? Hi, my name is Jennifer Hicks, and today I'm going to be talking to you about euthanasia. In today's increased longevity and medical advances, death can be prolonged and sometimes indefinitely. So when does a person who is diagnosed with a terminal illness have the right to determine for themselves how and when exactly they will die? Webster's dictionary defines this as euthanasia. Euthanasia is an act or a practice of killing or permitting the death of the hopelessly sick or injured individuals in a relatively painless way for reasons of mercy. The term euthanasia originated from the Greek word good death. It is an act or a practice of ending the life of a person either by lethal injection or the suspension of medical treatment. Many view euthanasia as simply bringing relief to alleviating pain and suffering. Wikipedia tells us, though, that there are different types of euthanasia. There's voluntary euthanasia, when a competent person makes a voluntary request to be helped to die. There's involuntary euthanasia, which is to end a person's life without their knowledge or consent. There's active euthanasia, which means to end a person's life by the use of drugs, whether by oneself or with the aid of a physician. There's passive euthanasia, which is to end a person's life by not taking the necessary or ordinary actions to maintain life. This can be done by withdrawing water, food, drugs, medical, or surgical procedures. There's physician-assisted suicide, and that is suicide accomplished with the aid of a medical professional intentionally providing the person with an overdose of prescription medication. And there's also assisted suicide, which is just a suicide accomplished with the aid of another person, not necessarily a medical professional. Assisting in death should in no way be an excuse for not giving the absolute best possible care, but should be considered a compassionate care and the respect for a patient's right to make death with dignity an option. When all other alternatives have been exhausted, the patient should have the right to die with dignity. This is where it may become a slippery slope, and careful consideration has to be taken by the patient and their loved ones, and real decisions are demanded during this time. These questions have to be asked and decided upon. When do we stop doing all that we can do? When do we withhold which therapies and allow nature to take its course? You cannot let the fear of death or advanced medical methods prolong the dying of individuals that are suffering. Every appropriate palliative option available must be discussed with the patient and, if reasonable, tried before the request for assisted death can be accepted. I believe that a person that is competent and terminally ill has the right to avoid excruciating pain and determine for themselves the time that they will die and have a dignified passing. The exercise of this right is central to our freedoms in America. If a person can choose to legally abort an unborn child, they should also be able to choose how they are going to die when they have been diagnosed with a terminal illness. No one should be forced to suffer unspeakable pain and go through months of undignified illness because the law tells them that they can't decide for themselves how to die. I believe that the government needs to stay out of these types of decisions that we have as humans and let us make decisions for ourselves and our families. The fact of the matter is it doesn't really make a difference if I believe in euthanasia or not. What I do believe in is that we all have the right to make our moral and ethical decisions for ourselves. I believe that if it's not okay for me, but you morally feel it's okay for you, that it's not my business, nor is it the government's business to tell us how and when we can do these types of things. So whether it's abortion, euthanasia, or what, I believe that we should be able to make those decisions for ourselves. Thank you.